And just a few questions. Is there enough level 1 data to say that the Regeneten offers superior outcomes compared to just repair alone?
Yes, it is weak point of these studies. You are right. So it requires randomized control study for the patient. Still, lots of the institute tried such a study. So as a practitioner, I clearly bet the result would be at least better. I cannot say it would be best choice, but at least could be more good choice than previous simple repair procedure, even though it requires something cost procedure.
And what is your take on PRP for a conservative treatment? If you're doing non-surgical treatment, what is your take on PRP?
Yes, the major effectiveness of PRP would be provide anti-inflammatory effect, additionally promote vascularity and healing mechanism. So in case of the stiffness or minor rotator cuff tear, and if patient do not want surgery, even there has an obvious rotator cuff tear, in such a case, only PRP injection in outpatient clinic also provides sufficient result.
Do you use in your practice PRP?
Yes, more than several thousand cases. Yes.
Okay. What is your take on massive rotator cuff tears? Large tears, massive tears which are irreparable. What is your solution? Or do you go for muscle transfers or do you for superior capsular reconstruction? What is your take?
In case of massive or large cup tear, I am divided into two parts. The one, patient can functionally elevate his or her arm properly. In such a case, I try to partial repair or patch graft or the repair and augmented with BioBrace or Regeneten. So I try to repair as much I can. If the patient cannot available for abduction properly, it is keep going. Maybe I try to wait at least 1 or 2 months. If patient still unable to moving arm properly, then I comment is let's go for the reversible surgery, arthroplasty.
You prefer arthroplasty.
Yes.
And what is your take on the lower trapezius transfer? There's a lot of interest in lower trapezius transfer, right?
I know that some surgeons prefer such a procedure, but some surgeons criticizing a little aggressive surgeries because trapezius muscle is not only useful for scapular movement, but also useful for breathing.
And there are some, Dr. Park from Korea also did the long biceps tendon.
Yes,
Right?
Dr. Park and lots of doctors like this procedure utilizing biceps rerouting.
They use
Yes,
biceps as a cable, right?
function in aged person, flexion and extension is depend on the short head of biceps. So long head of biceps can be utilized as supporting rotator cuff tendons. So it's a smart idea.